As families prepare to gather for the holidays, adults 65 and over face a heightened risk of severe infection from respiratory illnesses, especially COVID 19. Multi generational celebrations and long hours spent indoors create ideal conditions for viruses to spread. So, how do we protect ourselves and our older family members during the highest risk months of the year? Here with critical information is respiratory specialist Dr. Juanita Mora. Doctor, thank you so very much for joining us today. So, why are older populations more at risk for severe COVID 19 infections?
Well, what we know, David, more than anything is one is we age, our immune system weakens. So people greater than 65 years and older are going to have weakened immune system that put them at risk for complications from COVID-19. Second, people greater than 65 years and older are also higher risk for having chronic medical conditions that put them also at higher risk for COVID-19 complications, such as diabetes, high blood pressure, cardiovascular disease, asthma, COPD, or emphysema. And the last thing is just looking at the data. September of 2024 to October of 2025, we have had 44,000 deaths in the US from COVID-19. And 2/3 have been in people greater than 65 years of age. This is why it's so important that people get vaccinated and protected.
Okay, so what steps should families think about taking before these holiday gatherings?
The top holiday tips that I give patients: number one, vaccination for everyone. Everyone 6 months and older should get a COVID-19 vaccine to get everyone protected at your table. Number two, good ventilation at your holiday gathering. So good ventilation means putting that HEPA air filter on so that way we don't propagate the virus. Number three, people are sick, that they wear a mask, especially around our most vulnerable, the newborn babies, people greater than 65 years of age. Number four, as well too, that if they're feeling any cold symptoms, that they get a COVID-19 test kit and test, so that way we make sure if it's COVID-19, we don't propagate it within our family. And number five, universal precautions. Frequent hand washing is going to be key as well too in stopping the propagation of this virus.
Doctor, you'll be happy to know that my family is a vaccination station. We never miss our opportunity to get vaccinated, but a lot has been said about getting or not getting vaccinated. So where should our audience be looking for guidance on vaccinations for the COVID-19 virus?
Sure. What I tell patients, number one conversation can actually take place with your primary care doctor. They're your trusted vaccine messenger. Number two, you can go to trusted websites such as the Champions for Vaccine Education, Equity, and Progress, cveep.org, where you can also obtain all the information, English and Spanish, that people might need. The third place is local departments of public health websites as well too, that contain all the good information. And if you're trying to get the vaccine, you can talk to your local doctor or your local pharmacist, so that way you can get the vaccine. It's well covered with private insurance, Medicare, and Medicaid.
Okay, so what should we know about long COVID's impact on older adults?
Sure. What we know is that long COVID becomes a huge risk factor when people have had repeated COVID-19 infections. So number one way of preventing it is vaccination. So we know that COVID-19 is a very inflammatory virus, which means when it goes to the different organs, it can cause inflammation within these organs. So when it goes into the heart, it can put people at risk for arrhythmias, heart attacks. When it goes into the lungs, it can put people at risk for new onset asthma, COPD, or emphysema. When it goes into the brain, it can also put people at risk for strokes. And now there's a correlation between development of Alzheimer's and long COVID symptoms as well.
Oh, wow. Wow, I didn't know that. That's interesting. Okay, so where can we go to learn more information for local guidance and access to COVID-19 vaccines?
Sure. People can talk to their local doctor or their local pharmacist to learn about getting COVID-19 vaccines, usually available there. But they can also search their local department of public health. If they don't have insurance, they run free clinics for giving COVID-19 vaccines free of charge. And then the other place is obviously cveep.org, the Champions for Vaccine Education, Equity, and Progress.
Doctor, thank you so very much for your time this morning. It's been a very interesting conversation. And guys at home, if you want to catch this segment again or others like it, just head over to First Coast News Plus.